Assalamu alaikum. This lab is for the week 1 for the second stage for the musculoskeletal unit, including cell injury, cellular adaptation, and acute inflammation. This slide shows 3 histological sections representing the morphological changes in reversible and irreversible cell injury, necrosis. A representing the section from the normal kidney tubule with viable epithelial cell. The tubules are lined by normal cuboidal epithelium with round nuclei in each cell, and the tubule are arranged in regular margin, and they are normal in shape. B, early reversible ischemic injury showing surface blobbing. هنا الخلايا بدأت يصير بيها swelling, increase eosinophilic cytoplasm, eosinophilia of the cytoplasm start to be increased, and the swelling of occasional cell. بعض الخلايا صاير بيها swelling, بعضها صاير بيها increase in the eosinophilia. This is the early stage of cell injury اللي هي reversible stage. C, necrotic. وصلنا مرحلة النكروسيس اللي هو irreversible injury of epithelial cell with the loss of the nuclei, some of the nuclei lost from the cell, and the fragmentation of the cell and leakage of its content. Liver cell necrosis. Here we see the multiple sectioning representing the nuclear changes that occur in the necrosis. We have the upper left. This is the normal cells from the liver or hepatocyte with vesicular nuclei. Nucleoli is present, chromatin material inside the nucleus. The lower left is the karyopexis, اللي هو fragmentation of the nuclei. The cell becomes swollen and its nuclei fragmented. Epignosis, the cell contain condensed nuclei. The chromatin material is more condensed and as a dot appear as a dark dot. Karyolysis اللي هو fading of the nuclei, and most of the cell located in this section, the lower right section, are just containing the cytoplasm without the nuclei. Pattern of tissue necrosis. We have the coagulative necrosis on the left side. This figure shows coagulative necrosis of the wedge-shaped kidney infarction with a preservation of the outline. هذا الوedge yellow to whitish appearance. While on the right side, B, microscopical view of the edge of the infarct with normal kidney and necrotic cell in the infarct. تشوفون إنه الكدني tubules are preserved as architecture, but they lose their nuclei, and most of the tubule are containing cells without the nuclei. This is the necrotic focus. The necrotic cells show preserved outline with the loss of a nuclei, and an inflammatory infiltrate is present. This is the gross appearance of an example of the brain, gross appearance of the section taken from the brain, which represent a liquefactive necrosis. Here the affected area تكون wedge shaped. هتشوفون هذا المثلث, and pale, soft, and cystic. And in the upper margin of the brain, there will be a sloughing of the tissue of the brain or the parenchyma due to the liquefactive action of the bacteria that liquefy the debris and liquefy the cells, اللي هي damaged cells, and during sectioning it will be sloughed out and leaving this excavation inside the or cystic space or the cavity inside the brain tissue. هذا هو هنا الجروس appearance of two type اللي هو gangrenous necrosis والcaseous necrosis. On the left side we have the gangrene of the lower limb. تلاحظون at the left side هو dry gangrene اللي هو coagulative necrosis involving multiple layer, and wet gangrene اللي هو coagulative necrosis involving the lower extremities of multiple layer with superimposed infection. To the right side we have a caseous necrosis اللي هو in TB, tuberculosis, affecting the lung with a large area of caseous necrosis containing yellow-white. تلاحظون الكلر أصفر إلى أبيض and cheesy debris، مثل من تتلمسوها مثل الجبنة. cheesy جاي من الجبن، يعني تشبه الجبن. This is a gross appearance of area of white chalky deposit represent foci of fat necrosis with calcium soup formation اللي نسميها saponification at a site of lipid breakdown in the mesentery. This is a mesenteric specimen. Fibrinoid necrosis, this is another type. It is typically seen in immune reaction involving the blood vessels. There will be deposit of immune complex together with fibrin. This result in homogeneous bright pinkish appearance. Here, this is the histological section clarifying the wall of artery, which show in the wall of the artery circumferential bright pinkish. This a cool مثل الياخة أو الحلقة of bright pink area of necrosis with the protein deposit and inflammation darken nuclei of the neutrophil. This is the wall of the blood vessel. The center there is RBCs are present, and there is a necrotic area within the wall of the blood vessels. This is a gross appearance of the uterus. On the left side is the normal uterus showing normal mass of a smooth muscle in its wall. On the right is the uterus from a pregnant woman in which a striking increase in the mass of a smooth muscle is evident. This is a normal versus hypertrophied uterine smooth muscle cell. On the left side there is a small spindle-shaped uterine smooth muscle cell from a normal uterus. شوفوها spindle-shaped cell comes in a bundles, small in size. The nucleus مثل slit-like nucleus. Compare it with the right side. There is a large, plumpy, hypertrophied, highly smooth. The spindle on the left side become large, rounded, plumpy, hypertrophied, smooth muscle from the gravid uterus. This is another gross and histological appearance to the same يعني to the uterus during pregnancy. This is left ventricular hypertrophy. This is another example. This is a pathological hypertrophy of the cardiac hypertrophy. A number of the طبعا on the left side هو left ventricle and small هو الcavity اللي هو right ventricle on the right side. تشوفون the number of myocardial fiber never increase, but there is size can be increased in response to an increased workload. هنا طبعا عندنا احتمال persistent hypertension. They lead to marked thickening of the left ventricle in this patient with hypertension. Endometrial hyperplasia, this is a gross appearance. We see the uterus here is opened or dissected, and there is a prominent fold of endometrium in this uterus, and are an example of endometrial hyperplasia, both of endometrial gland and stroma. This is a gross appearance of atrophy seen in the brain. عندنا طبعا البرين هو عندنا sulci وعندنا الجيراي. الجيراي هي الfolds of the brain material, والsulci اللي هي grooves in between the الجيراي. تلاحظون هنا الnormal brain on the A اللي هو on the left side, while atrophied brain on the left side هو it is a brain of 82 years old man with atherosclerotic disease. طبعا atrophy of the brain due to aging and reduced blood supply. There is a loss of the brain substance. تلاحظون الجيراي shrinkage in its size and narrow the gyri with widening of the sulci. sulci اللي هي التجاويف اللي ما بين grooves ما بين الجيراي of the brain. This slide will show the epithelial metaplasia in a lining epithelium of the trachea, that there is a schematic presentation how the cell change from its normal shape columnar ciliated epithelium above the basement membrane with the gradual change into a squamous metaplastic changes, as shown in the histological section below. We have a ciliated columnar epithelium with their nuclei, and the cells are long, tall, ciliated, and transiently they lose their shape and transiently change into a squamous metaplastic tissue. هنا عندكم the two examples. On the left side is the serous inflammation. This is a low power view of a cross section in the skin blister. يراوينا الابيدرمس separated from the dermis by a focal collection of serous fluid. طبعا هذا الفلويد هو يبين هنا transparent اللي هو ما بين الابيدرمس above والدرمس below. تشوفون سبيس ابيض، هذا هو السبيس اللي هو containing the transudate اللي يسوي لنا البلستر. So this is an example of serous inflammation. In the right side, this is a serous inflammation of the serous pleural effusion, excessive accumulation of a clear thin fluid low in protein in the pleural cavity. طبعا هذا in the lung. تلاحظون هذا الشادو الشايني شادو اللي pointed by the arrow، هذا هو يراوينا السبيس اللي هو filled with fluid. وهذه التشو الصغيرة اللي هي in the center، هذه هي shrinked lung. هاي اللنج هي المتبقية بسبب ال pressure of the effusion on the lung. It is transparent, but note the reflection of light in the upper part of the photograph and lung will be collapsed. الأرو عليها هي collapsed lung due to the pressure induced by the fluid. هذا هو البريكارديوم fibrinous exudate, a deposit of fibrin on the pericardium. All these purple dots هي الفايبرين deposit on the pericardium. وهنا طبعا on the right side اللي هو histological section showing a pink meshwork of fibrin exudate. هذا F اللي هو pointed by F, and this will overlie the pericardial space اللي هو المؤشر ب letter P. الفايبرين طبعا احنا من نجي نصبغه it is a proteinaceous material يظهر ياخذ الصبغة الحمراء of eosin. الهيماتوكسيلين تصبغ لنا النيوكليوس ازرق، والايوسين هي الصبغة الحمراء اللي تصبغ لنا البروتينيشيوس ماتيريال. لذلك on the cross section الفايبرين يظهر باللون البيربل dark purple. And this is the purulent inflammation with abscess formation. تلاحظون هنا multiple bacterial abscess in the lung pointed in the arrow. They are yellow to white, a collection within the parenchyma of the lung in case this is of bronchopneumonia. On the right side is the histological section showing the debris and the collection of the necrotic material in the center, surrounded by the inflammatory cell infiltration, and many dilated blood vessels appear here. Reddish dilated blood vessels surrounded the focus of the inflammation. هذا هو الألسر. هذا الأبر بارت هو الكرونيك دودينال ألسر gross appearance. lower part هو البي اللي هو lower power cross section of the duodenal ulcer crater. طبعا هاي الحفرة مال الألسر احنا نسميها crater ulcer crater with an acute inflammatory exudate in the base. هذا كل الوردي هو inflammatory in the base of the ulcer، هو inflammatory exudate. Thank you very much.